Okay, ma'am.
Hi, I'm
Hey, Ellen.
Ellen. Thank you so much for this meeting. Bernie, you mentioned that we need a political revolution, and you mentioned Saskatchewan. We have a chance in Vermont to be Saskatchewan. There's a bill called H433. It would phase in universal publicly financed health care, but beginning with universal primary care. It's very cheap. It's under 6% of all of our health care spending. It would make primary care a universal, publicly financed public good. That would be good for Vermonters. It will keep people out of the emergency room. It was the single thing you can do to make a population more healthy. And so my question is, Dr. Leffler, if they take H433 off the wall of House Health, because we've got to think about Vermont, right? With all due respect, DC's not doing too well right now. So, if H433 comes off the wall of House Health in the Vermont legislature, will you, Dr. Leffler, not stand in the way? Thank you for answering my question.
So I'd want to understand where the money's going to come from. Okay, you're going to tell us?
Yes. Okay. The money would be raised publicly, but keep in mind that once we pay for any sector of our health care as a public good, then we can't be double charged. That is, an insurance company can't charge you for a service that becomes a public good, just like the roads, right, and the schools. So the idea, and keep in mind, very cheap, under 6% of total health care spending. So it'd be a great way to phase this in. You know, Bernie, when you were running for president, I wish you'd been president, but people used to say, well, how come they haven't done this in Vermont? This would be a way of starting with a relatively small but very impactful service. And I do want to make clear, and we should all know this, 187,000 Vermonters are underinsured. That means even if they have health insurance, they don't go to see their doctor because of out-of-pocket costs. They end up, every doctor will tell you this, I'm not a doctor, but doctors tell me this, you will end up getting sicker and waiting, and then you end up in the emergency room. And finally, I'll just say, the Oliver Wyman report said we would save $300 million if we made primary care universal.
Steve, what I would suggest, I know Ellen and I know Deb right behind her, and they've been working on this issue for years. I would appreciate if you sat down with them. And, you know, it's hard in a meeting like this to get all the facts. But I think Ellen's point is well taken, which I think you would not disagree with, that if everybody in the state has access to primary health care, in the long run, we save money, we improve health. Will you sit down and talk to these guys?
So yes, and so I want you to know I've met with VMS, who's sponsoring the bill. I've met with the representative of Madison, who's sponsoring the bill. We've started the discussion. There's a lot of detail we need to understand. And so I think that's where we're at right now, understanding it better.
All right, but you sound like a politician. All right. All right, but...
We would love to sit down with you.
All right. These things are complicated. I know that. And you can't make decisions right here. But I would like you to sit down with these guys. Is that something you could do? All right, Ellen, Deb, give him a ring? Okay.
Can I just give the follow-up to Ellen?
Yeah.
Yeah, I know, I want to be fair. But, you know, you talked about getting, you know, money that's already...
Deb, introduce yourself.
I'm sorry, I'm Deb Richter. I'm a family physician and addiction medicine specialist working on healthcare reform for years and years. But I wanted to make sure that, you know, people understand just a visual of, this was one family medicine practice I used to work in, 4 physicians, 2 nurse practitioners, who basically I asked them once to print out an insurance list. This was all the different insurances that we had to bill. And I just want to show you an example of one practice of, you know, what that looks like.
I think we got the point. And this is why one of the reasons why healthcare in America is the most expensive in the world. People should not be spending their time filling out those forms. Right. They should be treating patients.
That's $5,000 for every man, woman, and child in this country spent on administrative costs.
Right.
And this is the reason. With H433, we would have one insurer. insurer, essentially, or one payer that would pay, at least for the primary care. And
Right.
then we'd add the other second.
Right, okay.
Sorry for the...
All right, Steve, you'll sit down and talk about it. Okay, sir?
It's a tough act to follow. I'm a veteran. I get all my health care through the VA, and I can't say enough for them. They're great. I'm wondering why you don't support veterans care for all Americans. Because it's better than Medicare, because it's, for one thing, Medicare only covers 80%. The VA covers everything.
Well, as the former chairman of the Veterans Committee, I have spent years fighting to protect and expand VA healthcare. We're trying to get you, make sure dental care is available to all veterans as well, among other things. The point is, this, again, is not a healthcare issue, it is a political issue. There are people right now, you talk about expanding VA, there are people now who want to destroy the VA system, who want to privatize the VA system. You know why? Precisely because veterans in Vermont especially get good quality health care in a cost-effective way. That is a bad example compared to the private industry, all right? So right now, our fight, we're working with the VFW, the Legion, everybody else, is to make sure that we protect VA health. I can tell you, in this state, I don't know, we have many veterans here who use the VA health care? Good, does it work for you? Yeah. All right, generally speaking, no system is perfect. People feel very good about White River, the community-based outreach clinic here. So you're right, we want to expand it, but you should know that the big money interests do not want the government involved in healthcare.
For one thing, the VA is doing this whole health care program where they are helping us to learn how to eat properly.
That's right.
And how to exercise and everything.
And we're ahead of the curve on things like acupuncture,
Yes.
Yoga, and
Yes.
which reminds me, Steve, do you guys do much about in holistic medicine? Is that part of the...
We do. We have a chronic pain program. I see someone in line that's going to talk about it probably in a second. And we actually have one of the only contracts in the United States with our insurer, Blue Cross, that's a bundle payment for chronic pain that's shown huge savings, decreased ER utilization, improved quality of life scores, and it has a full spectrum of health benefits beyond just getting meds or just physical therapy, which are important. I'm not saying those aren't, but there's a lot of other stuff that we offer in that program that really is helping people.
And the VA and Department of Defense, ironically enough, people think they're conservative. They were way ahead of the loop on those issues. All right, let me go over here. Sir?
Liam Grima, doctoral student in sustainable development policy at UVM. Just want to thank you, Senator Sanders. You're my intellectual inspiration and the reason that I'm here right now. But I just wanted to say a structurally consistent theme underlying all of the crises that are being addressed, in my estimation, is an overdependence on market institutions, meaning a veneration and worship of markets as if they are some divine artifact that naturally allocate resources more efficiently than any social institution that prioritizes public welfare over private profit. They prioritize exchange value over use value. They don't distinguish needs and wants. Right now, you're talking about the issue of Vermont, so I want to stay away from the national level. There's a bill that was just brilliantly laid out to move towards that kind of system. Senator Sanders, in your estimation, how much of the opposition to the bill in the state of Vermont is genuinely ideological versus an actual malign corporate influence campaign like we see on the national level? And Dr. Leffler, if you wouldn't just mind, if we do succeed, as I hope we do, moving towards this system, as we attempted to do a decade and a half ago in that experiment that was terminated prematurely, which was a devastation. It was projected to lower healthcare costs overall, private and public, by $1 billion over a 10-year period. Would you be able to work within the confines of a universal healthcare system that's financed at the state level rather than the national level, or do you think there would be too many practical hurdles to not having access to a national pool? Thank you very much.
The short answer to your question is obviously the corporate interests, the insurance, drug companies, and other entities spend huge amounts of money. At the state? Yeah, of course they do. They go to every state in the country. And by the way, they are fearful. They don't like the VA. because VA provides good quality health care offered without any out-of-pocket expense. They don't like that. And they don't want to see any examples. What happens if Vermont had a system which was less expensive, better outcomes? That'd be the worst thing that the insurance companies would want. So yes, they're going to oppose that. Steve?
Thank you for your question. So first, I want to make sure you know that UVM Health is nonprofit. We have no shareholders. No one's making dollars at the end of the year on a dividend or something like that. All the dollars that we make, we reinvest back into the system. I will tell you that Vermont is pretty small, 639,000 people. I do have concerns that we could just not be an island, because that giant chart you just saw of all the charges, if we're trying to do it, what are we going to do when people from New York come into the state, or Massachusetts? You're at Stowe when you break your hip, or you come here, you're in Florida half the year, you come back. I personally have concerns that if we don't have some kind of universal system for the country, that it'll be very hard in Vermont. We're just so small. That's my take on it. I'm open to anything, but I think we need a national system.
Well, we certainly need a national system, but I think we can move toward universal primary health care in the state of Vermont.